Good evening, good morning, and good afternoon. This is the 1042nd day of continuous uninterrupted webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is none other than Dr. PARTHA CHAKRABORTY. He's from Malaysia. Let us begin the session with 1 minute silent prayer. Thank you. All of you know that the International Forum for Promoting Homeopathy comprises of doctors, homeopathic students, as well as homeopathic lovers. So it is entirely a different forum when compared to doctors forum only. So we will have to discuss many things here, including how to promote homeopathy among public, because public is the persons who are propagating homeopathy rather than homeopathic doctors. So we need support from homeopathic lovers also. As I told you, today's guest is Dr. PARTHA CHAKRABORTY. He is very familiar to our forum, and he has been doing two sessions as far as everyone is expecting, because we have no time to get into these discussions last two sessions. So we will get more time for discussion, so everybody can talk about ask questions during the sessions, and you can clear your doubt and everything. And as you know, he is a multiple choice doctor having expertise in all fields, and today he will be presenting a paper on as you know, the best thing about him is he is having lot of cancer cases, and today the third part of the subject is being discussed: management of brain tumor with homeopathy. Yesterday also he presented 3 cases, but today he will be presenting some more cases to us. So I think I am not no need of more discussion. Comments on this are because he has been very much familiar with our forum now. Everybody really read everything about him, and he is presently working as the associate professor of Department of Homeopathy, Lincoln University College, Malaysia. He is a winner of many awards. He has more than 2 lakh patients in his kitty. That itself shows how brilliant he is in practicing homeopathy. He has practices in India, particularly in Bengal also, West Bengal also. So let us begin the session. The third day's session, directly we invite, I am very happy to invite Professor Dr. PARTHA CHAKRABORTY to this forum. Welcome, sir.
Thank you very much. Can you hear me?
Yes, sir.
Okay. Thank you very much. It's a back-to-back session. It is actually an untoward request. Came from my friend Dr. Dhanesh, and for the whole day I was preparing this presentation. I was not ready at all, but thank you, Dr. Dhanesh. Thank you, Ifph, for giving me this platform. And good evening, Dr. Shani. He is one of my teachers in my PG course from Patna. I'm very happy that sir is sitting over here, and I feel great that I'll be able to present one case before him, because he's a very learned man. He's one of the most learned homeopaths that we are having in India right now. Okay, so let me share the screen. Yeah. So in my practice, actually, we don't have any choice. In India, we don't have any choice with any specialty, but definitely we have a choice of our own subjects. So I've been very interested in neurological cases, in cancer cases, and dermatological cases. And fortunately, in my practice, I've seen many neurological cases, cancer cases, especially brain tumor cases. I've been seeing brain tumor cases since 2003. So this today in this session, this third session, I'll be discussing one acute case, one brain tumor. It's a cancerous case, highly cancerous, highly malignant case. We don't know what will be the outcome of this case, but I'm presenting this case with 1 or 2 objectives. That is, how do we manage these cases in our clinic? And number 2, I just want to instill confidence in the junior people who are attending this seminar, my students, my juniors, colleagues, because in these sort of cases, when these acute cases come to our clinic, very often we get panicked, we get nervous, and very often we refer them to the neurologist. So just I want to spread a message through this case today that you don't get panicked. Hahnemann has left a lot of medicines for us to do very good works. We only have to know the medicines, we have to apply them judiciously. So let me start the part 3. Today we were talking about brain tumors. In the first part on 14th of June, we discussed about what is a brain tumor, classification of brain tumors, types of brain tumors, management, and I showed one case with where there was acute stupor in a brain tumor case. It was corrected with homeopathic medicine, single medicine, and it was corrected within 24 hours. I showed that video. Then part 2 was yesterday's session, where I discussed about the symptoms that will be getting according to the location of the tumor, because brain is a big portion of our body, and there are different parts, there are different lobes in the brain, and the symptoms that are manifested by the patient, they depend on the location of the tumor. They depend on the location of the tumor. So if we know this physiology, if we know this pathology, it becomes very easy for us to distinguish what are the symptoms to be taken for evaluation and repertorization. And then I discussed about 2 cases. One was of a astrocytoma, and another was of a granuloma. And then there were question and answers. Today, in the third part, because actually I have to leave a little bit early today. Today I'll be discussing only with one case. That's a case of diffuse midline glioma. And to be very honest, I must admit it very honestly before you that I have seen many brain tumor cases, but this diffuse midline glioma case, I've got it for the first time in my life in 2023. It's a highly malignant case. So I'll be discussing, my way of teaching is that, Dr. Dhanesh, that normally I tell about the physiology, the pathology portion, and then I go into the cases. So as usual, I'll move according to that. So this case is all about a diffuse midline glioma. In short, it's known as DMG. DMG. About this disease, I can tell one thing, that this particular disease was classified as a separate brain tumor only in 2016. Only in 2016, just 7 years back. Before that, it was considered as a simply glioma. But in 2016, after several cases were reported, WHO actually classified this as a separate entity, separate malignant tumor, and it was named as diffuse midline glioma. And this case that I have seen in my clinic was a special case, was a special entity of DMG that's called H3K27 mutated case. Now, what is a diffuse midline glioma? First, we must have a fair idea about this thing. What is a diffuse midline? From the name itself, you can understand midline. That means somewhere this tumor is situated in a line in a middle portion. So if we see our central nervous system, the central nervous system has got frontal lobe, occipital lobe, midbrain. There are different portions in our central nervous system. In the central nervous system, in the central portion, in the mid portion, if some glioma occurs, that is known as diffuse midline glioma. DMG usually is found throughout the midline structures of CNS. Normally, it's found in thalamus, brainstem, cerebellum, pons, this portion, even in the spinal cord also. So this entire midline portion might get affected by one sort of glioma that is known as DMG. So this is not a picture of the patient, but I have just taken from the internet. You can see this is a CT scan of a tumor, and this black area is a glioma. Now, diffuse midline glioma primarily is a primary central nervous system tumor. In the first lecture, I told that there are 2 types of tumors. One is a primary CNS tumor, another is a metastatic tumor. Primary tumors are those tumors which arise from the brain tissue itself. Metastatic tumors are those which actually metastasize from a different organ and they settle in the CNS and they develop into a full-blown tumor. Predominantly, they metastasize from the breast and the lungs. Anyway, this is specifically a purely primary central nervous system tumor. It's a very rare subtype of glial tumor. This glioma, these are arising from the glial cells, glial tissue of the brain. So this is a subtype of a glial tumor, and it looks like an astrocytoma. Yesterday we were talking about a case of astrocytoma. Astrocytoma means star-shaped. So apparently it looks like that. This one is the midline glioma, diffuse mid DMG. Now, what are the common presenting symptoms in a case of DMG? The common presenting symptoms in a DMG are the following. One is diplopia, the very important symptom, diplopia or blooding, mostly diplopia. Then the patient has got a problem in swallowing, cannot eat food, cannot swallow the food. So whenever he tries to swallow the food, there is a reflex cup and he vomits. Weakness of one or both sides of the body. This is also a very important presenting symptom of DMG. He can feel weakness in the hands, either single hand or both hands, both legs, and there will be a loss of balance. These are the common presenting symptoms of DMG. And in addition to these common symptoms of DMG, normally DMG, I told you at the very outset that this is a very, aggressive malignant tumor that we are having in our present days. So as it is a very aggressive tumor, it has got a tendency to expand very fast. And when it expands, it causes a perifocal edema around the structure, as a result of which there is an obstruction in the flow of the CNF, the central CSF, cerebrospinal fluid, as a result of which there is an increase of intracranial tension. There is hydrocephalus and intracranial tension rises in the patient. As a result of this hydrocephalus, the patient might have nausea, vomiting, irritability. This irritability is very important in brain tumor cases. Patients suddenly get irritable. There's a behavior change, personality change. Headache, sleepiness. Sleepiness is also one of the presenting symptom of any brain tumor. The patient relatives, they will say that, my mother is sleeping like anything. She was a workaholic. Now she is sleeping for 10 hours, 12 hours, 14 hours a day. So this abnormal sleepiness is also a presenting symptom of brain tumors. And in DMG, we can find this thing. And last but not the least, that is epilepsy or seizures. They can also happen. So this was a rough presentation about the symptom of DMG. Now, this is very important. In any tumor cases, we have to have a fair knowledge about the prognosis of any tumor, because then only we can tell the patient or the relatives of the patient how is the outcome or what are we going to achieve. Prognosis is very important. Prognosis of DMG is very, very bad, very poor. They are very aggressive tumors. And WHO grade 4 classification of tumors. That means they're highly aggressive, highly cancerous tumors. And in many of the references, they have mentioned that once DMG is diagnosed, the lifespan of the patient is in most of the cases only 1 year. Maximum, it can extend up to 2 years. So it carries a very poor prognosis in these cases. So this case carries a special significance for me in my career, in my practice, of course. Now, I'll come to my today's case. This was a brief introduction about DMG. And today's case, what I saw in my patient, diffuse midline glioma, possibly it was a mutation. It was a H3K27 mutated variant. Date of first report in my clinic was on 7th of June, just last month. Last month, I got the case. 7th of June, 2023. Patient was non-ambulatory. Normally, I prefer the patients to come in my clinic. When the patient father came to when he called me, I asked him to bring the patient in an ambulance at least. He told that I cannot take my son in the ambulance. He's so sick. He's totally bedridden. So patient was non-ambulatory. He came with his brother to me with the reports. Now, this is a brief history of the patient. Please go through the history very carefully, because this will actually lead us to the prescription. It was a 14-year-old male person, a schoolboy. He was bedridden. At present, he was bedridden totally. In November, the actual symptoms started. In November, he was having some sort of vomiting, some sort of weakness, could not go to the school. And they were going from the one neurologist to another medicine specialist in the local area. They were belonging to the state of the district of Birbhum in West Bengal. So they went to many doctors. Mostly they were allopathic physicians. They gave this medicine, that medicine, but this way they continued for 2 to 3 months. And then in March, they went to Nimhans, those who are from not from India. For your information, Nimhans is one of the super specialty neurological hospital that we are having in India. It's a referral hospital in India, very big hospital. So they went to Nimhans in March 2023 with this patient, when the patient was suffering from the following symptoms, that is vomiting, acute headache, weakness in 4 limbs. That means the hands, the legs, they were not walking properly. And while walking, he was having imbalance. He was having an imbalance while walking. So these were the presenting symptoms of the boy when he went to Nimhans. Now in Nimhans, an MRI was done on 21st of March. You can see I've represented the MRI report in toto in before you. You can see expansion of pons with heterogeneous ill-defined hyperintense signal changes. This hyperintensity, hypodense or hyperdense features means that there is something in the brain. So it was located in the pons, and the pons was expanding because of this tumor. And in pons, actually, when the tumor happens, they are very likely to compress the basilar artery. So it was extending. Over here, you can see there was an extrapontine extension. That means the tumor was expanding, and it was exerting some pressure on the surrounding tissue. And you can come down to this portion. Considerable mass effect was noted. Considerable mass effect was noted. And they underwent a biopsy in Nimhans, where it was written that diffuse midline glioma. It was already given in Nimhans biopsy that it was a case of diffuse midline glioma, WHO grade 4. And now over here, what happened? They gave some medicines to this boy, and they advised that you don't have to bring this child to our clinic. Better you can go to your state and you can consult with the Tata Medical Center in Kolkata. Tata Medical Center is another super specialty hospital dealing with cancer cases in Calcutta. A lot of people from this area, they are going to Tata Medical Center. So they advised the patient to go there. Now come to the histopathology report. Histopathology report, you can see that the section shows an infiltrative glial tumor and showing neoplastic astrocytic cells. So from here, it's very clear that it's a malignant case. Over here, the final impression has been written, diffuse midline glioma. So the histopathology and the MRI report both are matching. So it's a case of DMG. It's an aggressive tumor. It's a very dangerous case that we are dealing. Now, the patient was taken in May to Tata Medical Center because he had an aggravation after coming back to home. And in TMC, he was admitted over there. And the patient party requested the doctors over there that please operate the tumor. Then the TMC doctors, they honestly told them that the tumor is located very deep inside the brain. So it's almost impossible for us to reach there. Even if we try to reach there, we might not be able to excise the whole tumor as a whole. The stock will be remaining. It can flare up anytime. And in that process of excision of the tumor, we might hurt some other portion. Your son might become invalid. So it's better, instead of going for surgical treatment, we should go for radiotherapy. And the patient party went for radiotherapy. And the patient got 31 cycles of radiation, most probably, if I remember correctly. Then he was discharged in the last week of May because the acute symptoms subsided, and he was discharged from the hospital. This is the history following radiation. Now, while radiation was going on, he had some complications, post-radiation complications. One was grade 1 dermatitis, some sort of eczema, partial alopecia, papules on the face, and mucositis grade 1. That means inside the mouth, in the mucous membrane of the mouth, there were some ulcers. These are very common things of radiation therapy, side effects of radiation therapy. We know all these things. Now, this is one interesting thing that I am showing you. This is a prescription of Tata Medical Center. Over here, There are so many learned doctors, including our Sani sir. Sir, you can see the prescription over here. The first prescription was fluconazole. It's an antifungal given for the mouth condition. Cetirizine, it's an anti-allergic. Pantoprazole, digestive. Dexamethasone, it's an immunosuppressive drug. Crimafin for the constipation, and MSET for as an antiemetic. So, you see, they were actually beating the bush around. They were not trying to hit the exact tumor. Only they gave the radiation, and they were just beating the bush around. It was a tangential prescription. Why did I show this prescription? Because many of our junior colleagues, many of our students, they think that if these cases come, we have nothing to deal with these cases. They must be referred to the super specialty hospitals. No, we have many things in our armory. So within 7 days of discharge from the hospital, when the patient came back to the home, there was an acute flare-up of the symptoms. Now, what are the present symptoms? And when there was an acute flare-up of the symptoms, they decided to go for homeopathy. And they came to me. The present symptoms were like this: severe weakness in general. Severe weakness in general, that means the patient was weak in general, as well as there was weakness of the legs, cannot move, cannot walk, was lying in the bed all the time. I told you in the very beginning that he was a non-ambulatory patient. Cannot eat. Why? Because this tumor has got a tendency to produce some sort of vomiting, and the swallowing reflex is actually affected. So he was hungry, but he could not swallow the food properly. The swallowing reflex was gone. These were the symptoms. And he had some other present symptoms also. While eating, he had cough because the swallowing reflex was not correctly working. So when he was trying to eat, there was a cough, reflex cough, and the food was ejected out in the form of vomiters. There was salivation. There was salivation, stool, constipation. Constipation was severe in this patient, and speech was mostly unintelligible. Whatever he was telling, it was not very clear. Now I went for the constitutional symptoms because the father was there. I asked for something more regarding constitutional symptoms. I got this meager information because this patient party was a very poor patient party. They were not accustomed to this homeopathic case taking. So whatever I got, I'm just writing down. Food desires I got. He was passionate to take egg fry, chicken, fried food, and salty food. And another constitutional symptom that I got is that he was suffering from constipation since childhood, irregular and hard stool. That was a persistent symptom that I got from the father. Academically, he was moderate. Otherwise, everything I asked, they were not being able to tell anything. They were telling, no, it's normal, it's normal. And every time the father and the uncle was telling, please give some medicine so that my son survives. Because in the Tata Medical Center, in the New Hans, they were told that your son is not going to survive. They have told the truth to them. So this was the present symptoms. This was the constitutional symptoms. In the past history, I got nothing, only one small history. The father shared with me that at 2 years of age, the boy got a history of convulsion. But I cannot tell with confidence that whether this convulsion is associated with this brain tumor or it was associated with any fever, because at a 2-year-old child, there might be cases of febrile convulsions also. Even due to worms also, there can be convulsions. So this patient, the father could not tell me correctly, but yes, there was a convulsion at the age of 2 years. That was a notable history. Now, please remember that all the things were only just on the basis of the statement that the father was making in front of me. I was not able to see the patient because he was not brought to me. And every time he was requesting, give some medicine so that my son survives at least. I requested them for a video connectivity. They were belonged to a remote village. I could not connect with the video, nor I got any video from the patient. And one thing, because these patients are suffering so acutely, it's a very rare possibility that you will get a video from these patients. I do not have that video of the first sitting. Now I went through a rapid repertorization. I took 14 rubrics. Over here you can find. I started from mind, then generals, then I came to some particular symptoms. There are some common symptoms. But what I know from the repertoire is that even common symptoms, when they're persistently present, they become very strong. They become strongly characteristic. So I took these symptoms, and there were 7 drugs which covered 10 symptoms. There were 7 drugs, of which maximum score was scored by lachesis and plumbum. Lachesis and plumbum. And of these two, plumbum is known to cure brain tumors very much. It has been my experience. I have shared with you plumbum cases earlier, also the astrocytoma case. So I depended on my best friend plumbum metallicum. And this slide I must show before you, because every time, whenever we are seeing a case, maybe it's a acute case, maybe it's a chronic case, we have to remember our master's teaching that our duty is to make the sick people healthy, to heal as it is termed. That means to cure as it is termed. So over here, right now, in my hand, I've got a DMG case, which is highly malignant. So right now, my task is to take out the patient from this critical condition. That's my condition. That's the interpretation that I learned from Hahnemann's teaching. Now, my objective in this case, I set my objective in this case that given the present crisis, this is a critical case. This was a critical case. So given the present crisis, I have to first save or at least prolong the life of the patient, because the prognosis is very poor. The patient is destined to live for 1 year from the date that he was diagnosed. And when he came to me, already 4 or 5 months have passed away. So the first objective of my treatment is to save and prolong the life of the patient. And if I could save the life of the patient, next, our objective should be to improve the quality of the life of the patient. Prescription was plumbum metallicum 6, along with that calcarea float 3x. Now I've come to the last portion of my presentation. It's already 8:30 over here. So the second visit, the first visit was on 7th of June, if I remember correctly, 7th of June, I think, yes. Yes, 7th of June. And the patient came to me again on 23rd of June. That was the second visit. And I didn't know that the patient has come to my clinic. My assistants, they told me that, sir, you remember that brain tumor case, that child who could not come, he has come today. So I was very, eager to see the patient. Now the patient came with his parents, and I got the following report from the mother, which was very, very encouraging. She told me that my son is much better. My son is much better. His stool is regular. Now he's having regular bowel movements. Can swallow and eat food, because in these cases I told you that the swallowing reflex gets damaged, so the patient cannot eat properly. Now he can eat food. That's a great solace or satisfaction for the mother. And this cough during eating food has reduced. So all these signs are good signs. Patient had no confusion. And the best part of the story over here is that the patient, when he entered my clinic, I will show you the video. When he entered my clinic, he was narrating his own story. He was telling me that I am suffering from this, I am having this problem. So it was in one way very good. He was responding. Speech was intelligible. Every word was clear. He only complained of pain and numbness in the left side, weakness of the left leg. And walking is a little difficult. That I observed from his walking. So this was the present situation. Now, one information I got from the father of the patient, I don't know if this was very important or not, but I have recorded everything. Now, the father told me that he has got some new symptoms, like some sort of palpitation. And I could gather this information that this palpitation, he had a few experiences of palpitation earlier. So I don't know whether I have to take this as an old symptom, because if this is an old symptom and if this is coming back, then it's a good sign for us. It's a good sign for our prognosis of this case. Anyway, I've got the symptom, I've recorded it. I will follow up in the further checkups. Now, this is the video. You can see how the patient is walking. Small video. This boy. Okay, so this was the first part of the video. Now, my observation from this was the patient was still very weak. He needed support to be raised. He needed support while walking, and gait was unsteady. He was slightly tottering. You have noticed that he was falling down almost. The mother foretold of him. So this was the observation. He was still weak. Definitely he will be weak. Needed support to be raised. Needed support while walking, and gait was unsteady. Now you can go back to the second. This is a second video when he's entering my own room. Now you notice one thing. Is still carried by the mother. He is having some sort of lack of balance. And you can see my observation was that he was going to sit in the chair in front of me. I asked him to sit on the examination desk, and he could understand. He could understand. He complied with my request, and he came and sat on the table. So these were the small things that has to be observed while assessing a case, how the case is responding to your treatment. And the last video that I'll show you today. Now, over here, you see the boy is sitting in a very typical position. Can you see? Plumbar metallicum, we know that they normally they normally lie in a very typical position, but that is due to the colic that plumber is having. I don't know whether it's related, but I saw that this boy is sitting in a very typical position, one leg raised, one leg is hanging down. Anyway, so this one was the third video, the last video that I will show you. You see, and then I will explain.
তারপরে ও ক্লাস 9 মানে খারাপ পাঠিয়ে ছবিগুলো পাঠিয়ে টেস্টগুলি পাঠিয়ে
Now, you see, what I observed is that the precise movement of the hands has returned. He was feeling weak. He was having weakness of the hands, weakness of the legs. Now, this precision, this act of precision or precise movement, that is also very important in assessing any case. He is operating the mobile. The mobile requires a very precise movement of the hand, finer movement of the hands, and he's operating the mobile and in a flawless way. He's actually inserting my number to send his reports from his mobile to my mobile. He was transferring the reports from his mobile. So he was operating the mobile on his own. That was another good thing that I observed in the patient. And I am grateful to this patient father and mother, that they have allowed me to share the video with you, because I told them that I want to share with my colleagues, with my students. This is a learning case, I feel. So I am very thankful to them. So the achievement so far, I have just summed up. It's just the beginning of this case. I don't know what will happen in the future, but still, for this moment, it was a hopeless case. It was a severely critical case suffering from a highly malignant tumor. But they have immediately responded to the homeopathic medicine. That's the best part of this case that I've learned from this case. And the first challenge is now over. If he survives, it will be a miracle for us. Thank you very much. I've finished on time, Dr. Dinesh.
Exactly, sir. Exactly.
From you.
How many minutes you can wait, sir, here?
Sorry?
Can you continue up to what time? More?
Another 10 to 11 minutes.
Okay. It's really an excellent presentation with excellent case, ending up with a beautiful result. And this shows the power of homeopathy, and even a single medicine in the smallest dose work in a beautiful way in a cancerous case. Nobody could believe that such wonders can be possible with our homeopathic medicine. So let us start the question and answer session. Those who want to speak can raise your hand, and we will have a short time of discussion because sir want to leave for an acute or for an emergency. So please raise your hand so that everybody can raise, those who want to speak. And first it is Beatrice Gershner. So Dr. Beatrice, you can speak to Dr. Professor PARTHA Chakraborty.
Thank you, Dr. Danish. And thank you very, very much, Dr. PARTHA. It's such an impressive case. We are very touched to see that, what homeopathy is possible to make. So to have it clear, Dr. PARTHA, what was the time between the first administration of the remedy and the video? Was it 2 weeks, 3 weeks? You started with plumbum and calcium fluoricum. How much time in between?
The first day they came was on 7th of June.
Yes.
And
So
the medicine was started on 7th of June. And they reported to me on 23rd. So how many days? It's almost
2 weeks, more or less.
2 weeks.
Mhm.
Yeah.
2 weeks, more or less. That's incredible.
Yeah.
He could not eat. He could not
To
move.
be very precise, I asked the mother. The
Yes.
mother told me that the improvement actually started after 4 or 5 days, if I remember correctly. 4 or 5 days. They noticed improvement. The first improvement was he was sitting on the bed. He was asking for food and he could swallow the food. And then they noticed that once he started eating food, the bowel movement was regular. So this way the improvement started.
Incredible.
So within 5 days it began. The improvement began.
Yes.
So before going to others, I invite Sahani sir to say a few words.
Yes, sir.
Dr. Partha, I remember you, and I had been watching to your program, and several I have seen your lecture, and you are a genius, really a genius. And
Oh, sir,
you are really.
I require your
genius.
blessing, sir.
Yeah, I can say that it is a wonderful presentation, and within such a short time, one thing is very important, that how much you observe and you arrive at a particular medicine. This is very important, that you have. I think you have developed your very important skill in observing the patient. This is very important. The things that and on the basis of this observation, it was possible for you to arrive at the plumbum metallicum. So definitely it is a nice presentation. I salute you. I welcome you. I also bless you for the more better future, because you told me I am a teacher, your teacher, but I see today you are teacher for us. You are also a teacher
Thank you.
for us. So it is very great moment for all of us to learn very beautiful cases things. And since I have not attended your past 2 sessions, but I was told that you had been present. So I couldn't resist myself attending this today's session. So this is just continuation, and you keep coming to us, sir, and keep informing our, giving some good, and the way that you spoke, it was wonderful, because you were explaining at every point, and it was just a teacher-like explanations. So I appreciate this, and this is very important for us. So thank you, Dr. Partha, and bless you with all the
Thank you, sir.
better future in. Yeah.
And now it is up to Mr. Ahmad Azad. Please unmute.
Good morning, good evening to all. Sir, Dr. Saab, I want to your opinion regarding my wife. She's a patient of spontaneous CSF rhinorrhea.
Yes,
but,
yes.
But by the grace of God, since 8 years, she is no leakage from the nose. She is stable, but as a phobia, whenever she feels something, it is very difficult for us to manage, because I am in Saudi Arabia and she is in India. So for that, any prevention, I always take homeopathic treatment, because in allopathic they given only Diamax when she started 10 years before, and after that they told no need anything. At that time they want surgical, but I was unable to do that due to my financial problem. But anyhow, I thanks God she's all right. So any comments, sir? Any guidance, as you like, sir? Even on personal basis, sir.
Yeah. Thank you. You have been a regular listener to IFPH. You are one of the senior members of IFPH, I noticed. You have sent me the details. I went through them once, but I promise that I will go through the case again. And if required, I will take the case taking one day and then I will comment. Okay.
Thank you, sir. Thank you, sir. May I to bless you, sir.
Thank you, sir.
Now it is up to Joyram Ahmed. Please, sir. Joyram Ahmed.
Namaskar. First of all, I want to congratulate Dr. Partha Chakraborty. It's a wonderful presentation I have ever seen. It's a wonderful, hats off, awesome presentation. One thing I want to get the advice from Dr. Partha Chakraborty. Sir, what is the actual medicine? Is it only Plumma metallicum or calcarea floor also?
Definitely, Plumma metallicum was the main medicine. Calcarea fluor was you can say, a supplementary medicine.
But seeing your case, it is my opinion that only Plumma metallicum has acted over it. And is it necessary to continue it calcarea floor with it, or you will go along with Plumma metallicum?
Based on my past experiences, I prefer to give calcarea fluor, because always it has been my endeavor to deliver best results for the patients as soon as possible. So
Okay.
if calcarea fluor helps at least 1 to 2%, that is also good for the case. And this is exclusive from my past experience that I think calcarea fluor is acting nicely. So Plumma is definitely the best medicine and the only medicine over here. Calcarea fluor I have given just
of the character of the stool. Immediately it had started working, and what I think it was only the Plumma metallicum. And you have diagnosed over the physical symptoms only, because there is scarcity of mental symptoms, whatever. And right now I am the video, throughout the video, I have, it is to me that is now you will be collecting the lots of mental symptoms from the cases as he has entered in your chamber and everything. So hopefully the case will definitely it will gonna be a cure case. And it is a great achievement. Salute to Dr. Partha. Chakraborty for presenting such case. And I can personally tell you that today's lesson, it's a very much knowledgeable case in my life, you know. Thank you very much. Thank you very much for giving me the opportunity to attend this case. Thank you very much.
Thank you. Thank you.
It's up to Dr. Bobji from please.
Dr. Danesh, but you didn't allow me to start my video, so unfortunately you cannot see my face. You didn't allow me to start the video, so you can't see my face now. So never mind. I have a question for you, and thank you, Dr. PARTHA, for your patience and for generously sharing your time again since yesterday and today. Today's case is very interesting. It's something that we
Doctor,
most of
you
us
can open your
into.
You can open your video. Hello.
No.
Yes.
Okay.
Now you can see me.
Yes, yes.
Video. Okay. So the deletion, according to some of my friends, they have some relative who got this glioma. It seems that one of the specialists says who is studying about Nipah virus, the lesion is almost the same like Nipah virus lesion, and that the symptoms, according to what you write, is almost the same. So maybe that's a very good information and insight you have given to us. So maybe we can get the repertory again if you face a similar problem, and we can go to plumbum malaticum. What is the highest potency you use for plumbum in this case?
6.
60 only.
6. Normally, I start with 6, and after a certain time, when the patient becomes very sick, I prefer to go to 200.
So what is the protocol for the 6C? You take it daily for a week or what?
Yes, BD. 6 BD I dissolve in distilled water and I ask the patient to take BD twice daily.
Daily.
Twice daily.
Twice a day.
Twice a day, yeah.
Okay.
Shall I go to next person, Dr. Bobli?
Sorry?
Shall I go to next person?
Yeah, you can go to the next person. Thank you very much.
Yes. Dr. Sohna.
Good evening, sir. Salute you for your genuine and sincere approach in every case. Thank you, sir, for the presentation. 2 requests. One, can you share your phone number?
Yeah. Dr. Dhanesh is already having his number.
I shall
But
share.
otherwise, you can text me. Yeah, I'll respond.
Okay, I don't have your phone number.
Yes, I shall type here.
Okay.
Don't worry.
And sir, the repetition, can you again please explain the repetition of the medicines?
Sorry, repetition about the medicine.
Medicines given, both the medicines. How did you repeat the medicines?
Oh, okay. Plama metallicum, I dissolve in distilled water and I give BD. I make 16 doses, and then I give in a form of BD, 1 dose morning, 1 dose evening, and Calcreflo 3x. Normally, in adults, I am using Requec potency medicines. For adults, I'm giving 6 tablets BD. For this sort of cases, I'm giving 4 tablets BD.
4
and normally 4 tabs. Yeah.
Okay. And
Actually,
your plumber med, you dissolve liquid potency.
Yeah, distilled 6 in distilled water, and then I give.
Matlab drops of plumber med 6. How many drops?
Yes.
How many drops in how much water?
In 30 ml, normally I dissolve 30 drops, 60 ml, 60 drops, like that.
Oh. You divide it into 16 doses. Okay, sir. And
Yes.
BD. Okay, sir. Thank you, sir.
Now I invite Dr. Hariharan sir to speak.
Hello, sir. Hello.
Sir, you
So,
can open it.
Dr. Dinesh, can I leave, Dr. Dinesh?
Yes.
Oh, okay. Yeah, okay. Yeah, you are. Thank you, sir. Thank you, sir. See, it is very, very commendable. Very, it is a see one of the best case. One of the best case. See, I think. See, Plumbermet has wonderful action on glioma. I cured
Yes.
a case with the Plumbermet. On glioma case, I also cured one case. So I think this Plumbermet has got so much effect on glioma. How is your
We can
experience?
have a discussion on this this repertory also, the rubrics that are related to brain tumors that we are having in the repertory. We can have a discussion on some other day.
Okay, thank you very much, sir.
So we will continue with the session for 10 more minutes. But since sir has to leave, I invite Dr. Bob Lim to say what of thanks for sir only.
Are we going to close the session now so early today?
No. We will continue 10 more minutes, sir, because we will have to discuss. Everybody is here.
On behalf of the Ifph International, we welcome you to share your knowledge, and we are very thankful into this deep insight into the management of the brain tumor by homeopathy management alone. And they have given the public, other than us, a new insight on how homeopathy can help a patient with a brain tumor. So, and most of us here, the new one and the experienced one and the veterans one, we also learned a lot from you these few days, this yesterday, today, and the first session. So we are very, very grateful and hope that you will be able to come again and share with us in the very near future. And thank you very much, Dr. PARTHA.
Thank you. Thank you. Good night.
Thank you. Good night.
Good night.
Okay, sir. You can for the time being, thanks, sir. Anyway, we will continue with the discussion on Shivangi Jain. I want to speak. Yes, you can speak because we other people are here.
Yeah, good evening, everybody. Dr. Partha had asked me to share one of my cases with you because he was leaving a little early. So this is a case of recurrent meningioma. This patient had come to me some 10 years back. She was already operated. Sir?
You want to share the screen?
No, sir. Actually, this is just impromptu. Sir just asked me to share the case, so I'm just recalling it from the memory and sharing it. So this case was basically around 40-year-old lady, and she had been operated thrice for meningioma. Meningioma is otherwise a benign condition, but it can recur in, even after the surgery, it can recur again in patients. So she was extremely scared of undergoing the surgery fourth time. And that is the reason she came to homeopathy. And I was very reluctant. I was new into the practice. I was not very sure of, taking up a brain tumor case at that point of time, because she was having a lot of headaches and, vomitings, and the MRI had shown that there was a good growth. I don't exactly remember the precise location of the lesion, but it was a good growth. So I started this patient on Ruta. I'm sorry, I cannot share what indications were there. I don't have the details of the case with me right now. It is at my clinic. So Ruta was given in high potency. It was 10M, and I had repeated the potency probably once in 6 months or something like that. And there were some other indications. So Ruta was only a partially indicated remedy in this case. And I must say that I was, guilty of using another medicine. I started her on calcaria phos because there were some indications of calcaria phos, but because I had given Ruta in a higher potency already, I started her on calcaria phos 6x. So This case I treated almost for 2 years. She was much better. Her headaches came down, and she had no more vomiting. She gained weight, but the patient refused to go MRI because she was extremely scared of what the findings were going to be. But I can tell you that it has been 10 years that I have been following up that case, and the case has not shown any sort of recurrence. There are no headaches. The patient has not undergone MRI till now, but she continues to be well. So yeah, with that I will end this case. And there's another case of glioblastoma multiforme, which I have.
Dr. Shivangi Jain,
Yes, sir.
we will have a session from you. If
Sir.
you are interested, because you have cases with your kitty. Shall we fix another session? I think
Sir,
we can have a session. And I will fix the date.
it'll be a pleasure, sir. But I personally feel I'm too young and too naive to give a session as of now.
The age is not the matter. The content is what we are expecting from others.
I'll definitely. I'll definitely.
From 1 year experience are presented beautifully. So anybody can come up here and make your presentation. That's the beauty of International Forum for Promoting Homeopathy.
It will be my pleasure and a privilege, sir. It will be my pleasure.
Please share it so that we can definitely fix a session. So
definitely, sir. It will be my pleasure, sir.
Please collect all the evidence with you so that you can present it in a beautiful way here.
Sure, sir. Sure. I'll definitely do that. So, yeah. So another case, there was of this glioblastoma multiforme. I'm a general physician, so I really don't come across, I come across a lot of different type of cases, but there's no niche.
Time is running out. We can have a presentation from you in
Okay,
details.
all right. Done, sir. Done. I'll stop here then. Yeah.
Share your number so that we can have it later. Okay.
Sure. I'll do that, sir. I'll do that.
Okay. And now, I invite Sridhar to say a few words. Sridhar, are you available? No. So now I invite Dr. Shubhajit Banerjee to say.
Hello, everybody. I am
Sir,
audible?
sir, you can open your video, sir. You are coming.
No, I am some difficulty with my video. So am I audible?
Yes, sir. We can hear you.
Okay. Fine. Thank you very much, PARTHA sir, to provide us this evidence-based clinical case, which is encouraging for us to not to scare of these cases, but to deal judiciously and wisely with all the evidences, with all of our anatomy, physiology, and pathological knowledge, and of course the therapeutic part. So it was a great case, and hopefully all the members should come up with all these kind of cases. As we are all clinicians, we should know each other, and we should know the cases how to deal, but not to dare. So we should be dare to be wise. Thank you very much.
Thank you, sir. Now it is the time to wind up the session. Now, as you all know, that tomorrow we will have a session from Dr. Deepthi. She had two presentations. Some last week also, some Friday also, she had a presentation here, and tomorrow she will be presenting a paper on female complaints. With that, we come to the end of the English session, and now it is up to Dr. Shaila to moderate the Malayalam session. I invite Dr. Shaila. Good night to all. Thank you all. Dr. Manoj is here, so I invite Dr. Manoj to begin the session in Malayalam.